Hi. C'est un tel honneur d'être ici et vous parler. Merci de l'invitation. C'est également un plaisir, évidemment, de partager la scène avec mes 3 collègues que j'admire depuis des années. So thank you. And I'm here to tell you a story. When I met Mahmoud, he was 6 years old. He had sparkling eyes and crazy hair, like a lot of 6-year-olds do. Or rather, he used to have sparkling eyes, because for the past few months, the spark had been replaced by anger, and sometimes tears. He came to my office one fall morning of 2015 after his school's principal had asked me for help. Could I see him? She said. His teacher did not know how to help him anymore. He was sent home early every day after having spent most of the morning hitting and biting his teachers and his classmates, or curled up in a ball in the playground, refusing to come into the school. His mother was with him. She too was overwhelmed. Home wasn't much better than school. She described Mahmoud's rage outbursts, violence towards her and his sisters. She spoke of her being too tired to tell him no, so her coping strategy was never to tell him no, so in fear of triggering these unwanted behavior. She talked about his nightmares, and that when he would wake up from his dreams, he would want to protect her and his sisters. He was not eating, he was not sleeping, and all he wanted to do was to watch violent cartoons days and night. She didn't give much details, but she told me that Mahmoud's father had died and that he had seen his older brother get injured by con shots. She even told me this one day. Yeah, he did see some violence, but you can't imagine what I have seen myself. The family had arrived from Lebanon the previous summer, one of the first Syrian families to resettle in Saskatchewan. They kept to themselves. They didn't go out much, had no friends, and everything seemed unsurmountable. The story of Mahmoud's family outlines the many layers that need to come together when we care for refugee children. It's complicated, takes time, but it's so worth it. However, my first visit with Mahmoud left me a little bit discouraged. So much to do, so many phone calls, so many letters to write, so many battles with IFH. Why was his mom so resistant to SSRIs anyway? And when I suggested counseling, she laughed. She said, absolutely not. What we need is time. And of course, she was right, as moms are usually. So I'll come back to this story in a few moments. We often hear in the media and public discourses that refugees drain our system, that they cost too much. Is this idea based on reality, or is this rather a myth that would somehow allow us, as a society, as communities, even as individual healthcare providers, as Dr. Suleiman will outline in a few minutes, to justify escaping our collective responsibility towards people seeking refuge from violence and persecution? Let's examine this a bit closer, keeping in mind Mahmoud and his family, as well as his more than 50,000 Syrian compatriots who have resettled to Canada since the fall of 2015. What we knew back then, in terms of health and healthcare, of Syrian refugees in particular, was not much. Syria had a very decent healthcare system before the war, but 4 years of conflict had led to the complete destruction of its infrastructure and social safety net. Quickly, Syria had become the most dangerous place on earth to be a child. But regardless of that, what we knew based on migration surveillance data from Europe is that although people were more vulnerable to communicable disease due to poor living conditions and other factors, after arrival to their country of refuge, they did not come with a high burden of infectious diseases and did not end up posing threats to public health. Those same data also led us to believe that neglected or undetected chronic disease, including mental health, would form the bulk of Syrian refugees' health needs on arrival. So now it's 2019, 4 years later, looking in the rearview mirror, as the dust, at least here, is mostly settling, what can we see? There's still not tons of Canadian studies dedicated to our national experience with Syrian refugees. specifically when it comes to the 50% of them who are children and youth, which is why today's conversation is so important. But on the ground, we did see lots of kids with developmental, complex, multi-system conditions, and Dr. Hunter will talk about this a little bit later. And I got to read a lot of medical reports, I'll mostly stare at them because they're in Arabic, from Jordan and Lebanon. And if some conditions had indeed been neglected because of the inherent barriers to care that refugees face, most of the time, I was impressed. Kids were fine. Our system could cope. One thing they needed, though, is good dental care. And that has been one of the most complicated struggles that we faced, finding dentists to care for their dental needs. Outside of that, though, a good study out of Calgary last year looked at rates of TB in recently arrived Syrian refugees. And it did confirm what we hypothesized initially. Threats to public health, not really a thing. They found 0 cases of active TB and 0 cases of HIV. So overall, on a population level, the future is bright for refugee children in Canada. Their income as adults is higher than the average Canadian. The rates of high school completion is almost 95%. Almost a third finish a university degree. And we know, of course, that having a living wage and a good education leads to good health. I don't need to remind you of that. And ultimately, of course, it is health for everyone, all of us, that will allow us to achieve thriving communities. Because health is our best measure of success. For kids who have been refugees and who are now living in our communities, how can we use what we know about the migration determinants of health, which really are the social determinants of health applied to a specific context, to achieve this success? For all refugees and migrants, if the healthcare system needs to be ready to serve their needs, really the key for this lies in good support in our communities. If we can design and advocate for policies that support the stable settlement of migrant children, quickly resolve asylum claims, provide access to positive school environment, and promote access to healthcare, then we promote good health and positive integration trajectories. And if in addition to that, we also work for social inclusion, supportive family environment, and adequate support for families to provide this to their children, good mental health of caregivers, and positive school experiences, then we also promote resiliency. And this is exactly how Mahmoud got better. He came back to see me often after that first day, sometimes weekly, sometimes monthly, sometimes unannounced, most of the time late. And his first year was very difficult. Like a lot of other newcomer children, he experienced racism and bullying, more than his future kids and grandkids, if he chooses to have them, will have to. Indeed, we know that bullying is more common for recently arrived first-generation newcomers to Canada. But bit by bit, despite the challenges, the spark in his eyes came back. As he learned to speak English, he told me about the volunteers from the settlement agencies that came to his house to play with him and his siblings while his mother rested or went to her own medical appointments. He talked about his soccer team, organized by his EAL teacher. And eventually, he also talked about going to the soccer players' birthday parties. And I still remember an appointment where he told me about his first friend and how it is after that first time, that first appointment, that I didn't try to convince his mother to start him on Prozac. I saw him just last week. He's 10 now. His older sister just had a baby. His mom doesn't feel ready to work just yet, but she often volunteers after her English classes at the Mennonite Central Committee, where she's helping other refugees' families to resettle well in our community. We don't use an interpreter for our visits anymore, so we don't need one. Of course, he never took any of the pills I suggested, but he sleeps well now, and the nightmares are gone. He's growing well. He even speaks French. Quoi demander de mieux? Of course, there's still plenty to do to ensure that Mahmoud will have years of health ahead of him, and this is indeed our collective responsibility. So to finish, this is what I would ask of you. For your next weekend supper, and the weekends after that, talk to the children in your life. Yours, your neighbors, your nieces, your kids' friends, about what it means to be a refugee, about what is hard and what makes it easier and better. Ask these kids to be curious and open about the newcomer kids in their classrooms, in their school bus, in their swimming lessons. Because often, it only takes one friend to feel better.